This is a minute with Marty, and we have another great topic today. Our topic today is heart health awareness, and once again, I have Dr. Crystal Maxwell here with Light Family Wellness. And Dr. Maxwell, as always, it is great to have you back.
Thank you so much for having me again.
You know, heart disease that hits like some other diseases. It hits every family, and it's sometimes when you just hear it, you don't realize how it affects most everybody. So let's kind of start there. Where does it begin? How do you find out? Let's kind of genetics, different people groups. Let's start from there.
Okay. Well, it for heart disease, the big thing to that you mentioned was that it can affect everybody. In the United States, it is the leading cause of death for both men and women, and of all racial groups as well.
Mm-hmm.
One person dies every 33 seconds in the United States from heart
Mm.
disease. It is just that prevalent.
Yeah.
Over almost 700,000 people in 2021, the last time that we have data, died from heart disease. So we all know someone with heart disease, and it affects us
Yep.
in some way, whether it's personal, a family member, or a friend. So it's very important for us to be talking about it because it is affecting so many people in the United States. And when we look at it, people will say, well, what is heart disease? Or how do I
Mm.
know that I have heart disease? Um, Heart disease there are several different types. There's coronary heart disease, there's arrhythmias or irregular beats of the heart that can happen. There's cardiomyopathy, which is a big word that says that there are issues with the muscles of the heart,
Mm-hmm.
and it affects how the heart pumps. There's peripheral vascular disease, which affects the blood vessels of your extremities. There's valvular disease. So you can have an issue, you may have heard of aortic valve disease or mitral valve disease.
Yep.
So those are some of the common types, but the most common type that occurs and is prevalent is coronary heart disease. So that is that the blood that is flowing to the heart, that there can be a blockage in that flow, so that when you don't have that flow coming, you have what we call ischemia, that lack of oxygenated blood that goes to the heart, leading to heart attack.
Mm-hmm.
And then, of course, if that happens to the brain, that is stroke.
Right.
So lack of blood supply that goes to the brain.
Now, my quick question, and you may have touch on at some point here. We know, and we'll talk about diet and some different things. How much does genetics play into this? Because it's on my side of my family. I mean, it's on both sides, and I've
Mhm.
had some testing done, and fortunately, I'm doing pretty well in that area. But I mean, it's on my mother's side's eat up with it, my dad's side's eat up with it, and some families just don't deal with it at all.
Right. So yes, we see heart disease running in families. There's some genetic markers for heart disease, particularly with some of the cardiomyopathy, particularly hypertrophic cardiomyopathy. And then, of course, even when we tend to see coronary heart disease, we do tend to see that run into families. And
Mm-hmm.
there's multiple reasons that can come into play, from genetics alone, but also in the styles of foods that we eat. So depending on how you grew up, what your mother ate while she was pregnant with you, what you were growing up eating, while you were a child, while you were a teenager,
Mm-hmm.
the way that you learned to cook, may be ways that increase the risk of heart disease. And so you've carried that into adulthood now that you're cooking for your kids. So
Yeah.
there still are some lifestyle component things that we do see to that, but we also do see just genetic genes playing a role. Familial hypercholesterolemia. There's some people have really, really high LDL cholesterols that is
Mm-hmm.
strictly genetic, even when they try to control
Yeah.
lifestyles.
Yeah.
So we do see those genetic components to it as well.
I'm gonna go and tell my mother that while she was pregnant with me, she ate peanut butter and pickles, and that must have been what really helped me out. I mean, hey, you never know. So it's kind of funny. So some of those risk factors, you mentioned cholesterol, high blood pressure, smoking, there's different things that can cause a lot of this.
Yes, smoking is the most preventable cause of heart disease. So smoking is very much up there in terms of risk factors for heart disease. So if you are smoking, that is one definite thing that you want to decrease, as well as alcohol. Alcohol does increase the risk of heart disease. We do have some studies that show white wine drinking in moderation, meaning 1 to 2 glasses. And so not the whole bottle,
Yeah.
but red wine can be cardioprotective, but that's just red wine, and that's not typical of what most people drink. So you do want to
Yeah.
look at your alcohol intake as well. Another factor that people don't really take into account as much is stress.
Yep.
Stress increases the risk of heart disease. There are a lot of people who are physically fit, they exercise, they eat very healthy diets, but yet they still died. And when they looked at their stress level, the way that their sleep patterns and things like that, they lived a very stressful life, which likely contributed to their early death.
Yeah. Okay. Now, this is a side question. It may sound kind of odd because you brought up red wine. Okay. What about grape juice?
Grape juice, unfortunately, the majority of grape juice, unless you are juicing it yourself, is processed juice,
Yeah.
and is predominantly sugar.
Sugar.
So that is not necessarily cardioprotective.
Okay.
But if you're eating, I mean, just eat some grapes and juice it
Eat some
yourself.
grape.
But if you're buying it out of the
There we
store,
go. There we
if
go.
you're buying it out of the store, unfortunately, it's probably already very processed.
Yeah.
So it's not going to give you that benefit of the processing that happens for red
Right.
wines.
Okay. Interesting. Okay. Now, what I'm hearing from you is, apart from genetics, we're the cause of a lot of our ailment.
Yes. The foods that we eat, particularly heavy carbonate, high carb diets, highly processed food, vegetable oils are very inflammatory to the body, and can create plaques in the body. So when we're eating these highly processed foods and snacks, they can cause inflammation in the vessels, leading to heart disease. So we do need to take into account how much carbohydrates that we are eating, how many, how our food is being prepared in the processed foods. Trans fats are very bad for our body. So we really should be eating more omega fatty 3s and fish, and eating whole foods as opposed to processed foods. So, yes.
You mentioned oils a good bit. Olive oil is a good thing. Mediterranean
Olive oil is great.
diets. Yes.
Yes. So Mediterranean diet is great. So really eating our food in its wholest states. So having colorful plates of fresh fruit and vegetables, and water is our friend. Most Americans are dehydrated by lack of water. We really should be drinking at least half of our weight in water each day. So having water, having those fresh fruits and vegetables are very important. And then those healthy fatty fish, like salmon, tuna, are very good.
Just said half of my body weight in ounces of water.
And ounces of water.
I have to work at some point here. That's a lot of drinking. Not a lot of drinking. You mentioned that olive oil. So if my mother is watching, Mama, she takes out olive oil every day. I mean, a tablespoon or something. She is a connoisseur of olive oil. You're doing the right thing. So kudos to Mom.
Good job, Mom.
Yes. Now, talk about, heart attacks. Some of some of the symptoms people, because, sometimes you might feel this crazy, oh my goodness, and this happens to be on the left side of your heart. And you're like, okay, that was a pulled muscle. What should somebody look for? I mean, what are those signs?
So the classic symptom is going to be chest pain. So we tend to think of left-sided chest pain that radiates down the arm. But that's kind of classic of men.
Yeah.
Women tend not to have that. Some women may have more of a pressure type
Mhm.
sensation, or feeling like there's an elephant on the chest, or feeling like there's really bad indigestion that just won't go away despite taking multiple antacids or
Mhm.
proton pump inhibitors. So if you're having that discomfort and it's not going away, and it seems to be more intense than just, if you burp and it's not going away and it's
Mhm.
staying there for days, that's more concerning. And then there's some people who may have just feel shorter breath, or unusually more tired than they normally do. They can't do the same level of activities that they normally
Mhm.
do.
Mhm.
Some people don't have symptoms at all, which is, the even scarier part
Yeah.
about heart disease, is that some people will not really recognize or have noticeable symptoms until it is that massive heart attack, unfortunately.
So if diet does not work, what are options?
So diet still plays a role. It is not the only thing. Exercise is also important. We want to be doing some aerobic and resistance style exercises. In addition to that, you do need to know what your numbers are, because even just eating and exercising, if you don't know what your blood pressure is, blood pressure, high blood pressure is one significant risk factor. And it can be what we call the silent killer, because there are a lot of people who will walk around and not feel that their blood pressure is high. And if it's not been checked and you are having elevated blood pressures, that puts you at risk. So knowing your numbers of what your blood pressure is, knowing what your triglycerides are on your cholesterol panel, those increase the risk of heart disease. Knowing what your HDL is, that's considered the healthy cholesterol. So do you have a good level of healthy cholesterol that's floating around? What is your LDL? That calculated number is part of what we look at in terms of increasing risk of heart disease. Do you know what that number is? And then, of course, you want to make sure that you're doing things to help move those numbers into the right direction. So knowing your numbers as well is very important, in addition to the nutrition and exercise, and being on appropriate medications or supplements to help improve those levels.
Now, it's the same idea that if you want to lose weight, you can't keep eating the donut and still get on the treadmill. It don't work that way. So if you've taken medication, that does not mean you can go out and eat a large pizza and a double cheeseburger.
Right. So, everything in moderation, really. Um, e- but we do have to be smart when we are putting things into our body. What we're putting into our body? What effect is that going to have on us? And so we do have to take that into account. We may exercise to get some of the calories off, but just like you said, if you're going back and putting in processed foods that are going to be inflammatory and damaging to the cells that's in our body, then we are counterproductive to, all of that effort that you put into the treadmill or the elliptical.
Yeah. Now, let's just say I have not had problems. I generally have good cholesterol. Are there any kind of test that somebody could preventive test that they could seek to have done to make sure things, because you see some once in a while I get a flyer about have your neck scanned and some different things. Is that advisable?
It's a discussion to be had with your primary care doctor or cardiologist. Those tests are not recommended just to go screening everyone at a certain age. If the data were good enough that it showed that there was more benefit than harm to doing that, we would be recommending that, but it's not. So it is a discussion to have with your primary care doctor or cardiologist about what your risk factors are, what your family history are, what
Mhm.
symptoms you may be having, to determine which type, because there are various, from the carotid ultrasound to the CT, calcium scoring, and then the blood test. But doing those tests is not just for everyone, so it is best to have that conversation with your physician to make sure that the appropriate test is being done for you.
You said something that triggered. My On a personal note, my dad had a heart attack and had a quadruple bypass this past July, and I went back and my current primary care said, you've got your family history. Go back to my family history, and I had you talked about calcium scoring.
Mhm.
I had the MRI with the calcium scoring done, and I found that, you know, it's a piece of the puzzle. And give me your opinion. Piece of the puzzle that was helpful because my numbers are borderline, and then had this done, and my calcium score was low. So I know, again, it's another piece to the puzzle, but I think those things are vital and another piece to check
Another
things
piece
out.
of the puzzle.
So
Yes.
okay, so you said that, and I was actually going to ask you that before. I know, well, I didn't want to ask her that, and sounds stupid. Then you brought it up. So hey,
No, you're right on point.
so well, good deal. So what I'm hearing, and a good wrap up is, take care of yourself, exercise, eat right, properly. There are good ways to eat, and eat certain things in moderation.
Mhm.
Take your medicine if it need be. Make sure you do that every day, habitually. And when it's all said and done, you know, maybe you'll be okay.
Yeah, exactly. Have those conversations with your doctor. And especially, I hear a lot of people who may mention that they've had side effects from things, so they don't want to take their medicines,
Yeah.
or they're concerned about the side effects of the prescription medicine. But have that conversation with your physician about what your concerns are so that they can give you evidence-based um, resources to look at, and help to guide you through. Maybe that pill is not one for you, but maybe there may be an alternative for you that is.
Yeah.
But if you don't share that with your doctor, then they don't have any way of knowing that you need something else.
Yeah.
So have that open conversation so that we can make sure that we're doing things to help decrease your risk factors.
Yeah, I've heard, you know, a good point, because some people will say, well, that cholesterol medicine hurt my legs. You know, you get that, and then they'll decided not to take it, and I just, you know, walked away from it. So like some people in my family walked away from it, and you know, it's not a good thing to do. So continue to talk with your physician to find something that works for you, because everybody's different.
Yep. Everyone is different. Everyone is different. I have been on the patient side myself. I actually, when I was 30, went through congestive heart failure, and I was in severe stage, and I was on a lot of medicines at the time.
Wow.
I developed a really bad cough to an ACE inhibitor, lisinopril. And but I let my doctor know once I
Mhm.
realized that, or my husband realized, because I had, when it's come to myself, my doctor had us kind of off
Yep.
sometimes.
Yeah.
And so he had to tell me, he's like, I think you have the ACE cough. And I was like, oh, I guess that is why I'm coughing so much. And we switched my meds, and I tolerated it very well. But had I stopped it and not had that conversation
Yeah.
with my doctor, I would not have found something else that would be beneficial, but without that
Right.
side effect. And I may not have healed, in the way that I did.
Yeah.
So, it's very important to let your doctors know what's going on with you so that they can give you some alternatives.
Communicate, communicate, communicate. This is a great topic. Any last bit of nugget?
Yeah. Know your numbers, know your family history. It's important to talk to family to know what the family history is. I know sometimes we don't really talk and share about certain things, but it's important that we do investigate what our family history is so that we know our risk from that standpoint. And that we do look at what we're putting in to our body. That old adage, we are what we eat. We really are. So it's very important that we look at trying to incorporate more whole foods, less processed foods as much as we can.
Awesome. Dr. Maxwell, as always, this is a great topic, and I appreciate you taking the time today to educate us all.
My pleasure. Thanks for having me.
All righty. Well, we'll have her number on the screen. If Dr. Maxwell can help you in any way, give her a call. Everybody else, appreciate you watching A Minute with Marty, and hope you have a good day. Take care.